Following peak bone mass attainment, human skeletal microstructure steadily deteriorates. Eventually, the mechanical load exceeds the structural capacity, and the bone shatters. This physical degradation accelerates rapidly after menopause. The resulting lifetime risk of sustaining an osteoporotic fracture reaches approximately 50% for women over the age of 50. To maximize lifespan, modern longevity medicine aggressively promotes plant-based diets, while routinely advising patients to restrict their intake of animal protein and dairy. Yet massive cohort studies published in 2024 reveal a contradiction. These specific dietary restrictions correlate with structural bone failure in aging populations. Preventing osteoporotic fractures in clinical practice requires looking past entrenched dietary biases regarding plants and protein and examining the actual biochemical mechanics of bone preservation. We have to start by addressing a long-standing biochemical assumption, the acid-base hypothesis of protein metabolism. For decades, practitioners cautioned that high-protein, acidic diets induced systemic acidosis, forcing the body to leach calcium from the skeleton and flush it out through urinary calcium excretion. Recent observational data has completely invalidated this model. Longitudinal studies of community-dwelling adults show no reduction in bone mineral density from acidic diets. Instead, higher dietary protein actually increases lumbar spine bone density and improves the predicted failure load of peripheral skeletal sites. Because older individuals experience impaired protein assimilation, modern geriatric guidelines now advise increasing dietary protein up to 1.2 grams per kilogram of body weight per day. Protein-induced acidosis is a myth. The actual threat to the frail elderly is insufficient protein intake. This flowchart illustrates physiological responses to nutrients. In the upper right, we see how dietary protein protects the skeleton. Protein provides building blocks, specifically aromatic and sulfur-containing amino acids. These stimulate IGF-1, directly driving bone formation. However, there is a strict physiological caveat to this process, established by the Dawson-Hughes intervention trial, the protein-calcium interaction threshold. High animal protein intake protects whole body bone density and reduces hip fracture risk only if the patient consumes at least 800 milligrams of calcium per day. If a patient's calcium intake falls below this 800 milligram threshold, a high-protein diet exerts the opposite effect, actively harming skeletal integrity. In clinical settings, protein and calcium operate through a strictly dependent biochemical synergy. You cannot manage one while ignoring the other. The standard clinical response to this calcium requirement is prescribing isolated calcium pills. But isolated supplementation yields inconsistent results. Meta-analyses show that calcium alone does not reliably reduce fracture risk across populations. A far more effective intervention utilizes the dairy matrix, a complex structural interaction of food components that provides a biomechanically superior delivery system. Unlike a singular calcium supplement, a dairy matrix simultaneously delivers highly bioavailable protein, calcium, phosphorus, and vital cellular growth factors directly to the digestive tract. In a recent landmark randomized controlled trial of vitamin D replete nursing home residents, increasing dairy intake reduced all fractures by 33% and hip fractures by a massive 46%. The primary clinical objection to prescribing dairy is the deeply ingrained fear of increasing the patient's cardiovascular disease risk. Recent global data dismantles this objection. The 21-country Pure cohort study, tracking over 136,000 individuals, demonstrated that dairy consumption, particularly fermented dairy, actually correlates with lower risks of mortality, coronary heart disease, and stroke. Restricting complex dairy matrices out of an outdated cardiovascular heuristic deprives the skeletal system of the specific nutrients it requires to prevent structural failure. This brings us to the most prominent longevity trend in modern nutrition: strict plant-based and vegan dietary patterns. This chart visualizes fracture risk metrics from recent massive observational data, including the EPIC Oxford study. It shows that strict vegans carry a hazard ratio of 2.64 for hip fractures compared to regular meat eaters. The physiological consequence is severe. Without animal protein and dairy, vegans exhibit severely altered trabecular and cortical microstructure, a deficit they can typically only mitigate through heavy resistance training. Compare this structural fragility to the bone protective effects of an omnivorous Mediterranean diet, which provides an abundance of vegetables alongside high-quality fermented dairy. The mechanistic difference between these diets lies in the lower digestive tract. Complex dietary matrices physically alter the diversity and function of the gut microbiota. When non-digestible prebiotic fibers reach the large intestine, local gut bacteria ferment them, producing beneficial short-chain fatty acids. These specific short-chain fatty acids, primarily butyrate and propionate, actively improve intestinal barrier integrity, allowing the body to optimize the systemic absorption of minerals. Furthermore, researchers are currently studying microbiome byproducts like urolithin A, a postbiotic derived from pomegranates that has demonstrated an ability to actively inhibit osteoclastogenesis, the breakdown of bone tissue. Mechanical bone strength depends on the metabolic outputs of the gut microbiome working in tandem with mineral absorption. This complete flowchart visualizes all the converging inputs of human bone health simultaneously. Bone functions as an active, protein-dependent tissue governed by complex gut-bone crosstalk. To effectively prevent osteoporosis, clinicians must discard restrictive, exclusionary ideologies surrounding animal protein and dairy consumption. The empirically supported anti-fracture matrix requires 3 overlapping inputs: calcium intake exceeding 800 milligrams per day, high-quality protein pushed above 1.2 grams per kilogram, and a steady supply of gut-modulating fermented foods and fibers. Skeletal longevity depends on the synergistic architecture of complex dietary matrices.